A very good evening, all of you. Welcome to day 4 of our 7-day challenge. So, in this dinner session, we'll start with previous homework questions and then we'll move on to a case based or scenario based question. So, I hope your day has been fantastic so far, and let's make it even more amazing with this lively and lovely interaction. So, I'm looking forward for the same. So, I hope you guys are all ready. Yes. So first and foremost, this is fourth day of our 7-day challenge. We crossed our halfway mark. So just another 3 more days to go to complete this 7-day challenge. So today morning, we had a wonderful session in the form of meditation, and also we discussed something positive in specific regarding the vaccines, and to be more specific in regard to Sputnik Light. Sputnik V, Sputnik Light, and it's a single dose vaccine. Also, we had a question in regard to this in our updates group. And I'm glad that majority of you, I think more than 60% or maybe even 70%. So majority of you have answered it right. Yeah, around 79%, which is very impressive. So just keep this enthusiasm going. Now let's move on to our previous homework questions. But before that, as I said, I would like to highlight certain individuals who contributed enormously in helping humanity eliminate leprosy. So we'll go through that literature, and the reference will be Bailey and Lau. So this is the information we have. I'm sure it's not very clear to you. The letters are very small. So we compile it in a separate file for your convenience, and we'll shift our slides now and then go through that literature. So we'll have a literature review, brief literature review, and see how they've helped, these gentlemen helped all of us to eliminate this infection. I mean, at least finding solutions, if not complete elimination, unlike smallpox. So first and foremost, let me know if you can go through these letters, right? I try to zoom in as much as possible. So owing to the stigma attached to the word leper, Cochrane suggested that the best name for leprosy is Hansen's disease, which you're all familiar with. But why Hansen's disease? So who is Dr. Hansen? So Gerhard Henrik Armour Hansen, 1841 to 1912, is a physician in charge of Filippo Hospital disease. And also, who is Cochrane? Before I proceed, my system says that the internet connection is unstable. Guys, let me know if it is streaming fine or not. Yeah, one of you please confirm whether the streaming is going on fine, whether the audio is fine or not, because I just got an input saying that the internet connection is unstable from the Zoom app. Do confirm the same. Sohini, Sonali, Felicia, thank you so much. So let's move ahead. So what about Cochrane? So Cochrane 1899 to 1985, is a medical missionary who became an international authority on leprosy, who devoted his time to leprosy patients in Southeast Asia, particularly India. And Domak, the person whom we discussed yesterday, if you remember. So German physician, lecturer in pathologic anatomy, University of Munster, Germany, discovered Prontosil in 1935, for which he was awarded the Nobel Prize for Physiology or Medicine in 1939, Dapsone, if you remember. And Wilson Brand, Paul Wilson Brand, 1914 to 2003, was born to missionary parents in southern India and qualified in London in 1943. He himself was a dedicated missionary who was an extraordinary gifted orthopedic surgeon who straightened crooked hands and unraveled the riddle of leprosy. As a pioneer in tendon transfer techniques, he established and practiced initially in New Life Center, Vellore, southern India, Shiflin Leprosy Research Center, Karigiri, South India. Initially, he trained as a carpenter and builder and maintained that his training as a carpenter helped him in his expertise in tendon transplantation. When he was awarded the CBE, I think it's something related to his knighthood. I'm not exactly sure. But since he is from London, right, British, I reckon it is something to do with that. His wife Margaret came to know about it when she found a letter from Her Majesty's government informing him of the award while emptying the pockets of his trousers before they were put into wash. So Her Majesty, in the sense, Queen, British Queen. So he later moved on to Louisiana State University, LA, Los Angeles, where he continued his work, and finally to Seattle as Emeritus Professor of Orthopedics in the University of Washington, Seattle, USA. Margaret Brand, alongside her husband Paul Brand, also contributed immensely to the health of leprosy patients by concentrating on research to prevent blindness in leprosy, and she became known as the woman who first helped lepers to see. And Frank Tovey, another English surgeon at about the same time, also performed extensive tendon transfers, facial and other reconstructive surgery on leprosy patients in southern India in the state of Mysore, Karnataka. In this, he was helped by his wife, Winifred, who organized the physiotherapy and rehabilitation of the patients and established village diagnostic and treatment centers. And if any one of you thinks that marriage is a hurdle to go ahead with your professional career, we're all wrong. You can see we have classic examples over here. Wife and husband dedicating themselves towards what they believed, right? So this is some information which I've taken from Bailey and Lau, 27th edition. Yes, how being a carpenter helped him expertise in tendon transplantation? It's about hand skill, don't you think so? In fact, if you closely observe, those who have this hand skill can be carpenters or are doing other works. If you train them, they can do excellent tooth carving. The best example which I can give you is the lab technicians, right? So they're not doctors, but still they do a good job, isn't it? I mean, I'm talking about the technical aspect. Okay. So now, Twinkle, now don't get inspired and start your carpentry work. I mean, if you're really interested, I would definitely encourage you, but this is just an example to tell you that it doesn't matter which profession you're in. If you're passionate about what you're doing, you'll start mixing things up only to improve the given scenarios, isn't it? So these are some of the individuals which I wanted to highlight. These are given in footnotes in Bailey and Lau, the 27th edition. So now let's move on to our homework questions. So I posed some questions yesterday. I'm sure some of you have sent mails with your homework. I really appreciate your enthusiasm. So these are the questions I asked you. Paul Brand's procedure, Barnell's procedure, Ober and Barr's procedure. So you can make a note of it, and you can also find the reference, Manipal Manual of Surgery. I'm sorry, it's not 27th edition, it's 4th edition. It's a typo. Okay, 4th edition. The one which I referred. Moving on, today's case-based question. A patient is prepared for endodontic treatment of mandibular first molar. Anesthetic block is given with lignocaine to inferior alar nerve. Patient describes profound numbness of ipsilateral lip and tongue. Confirming the above signs, dentist started with access opening, which made the patient jump out in pain. What will be the next step? Counseling to reduce pain, wait for some time, give another nerve block, or proceed with intraligamentary injection. So which one do you think is more appropriate answer? And if you look into this case-based scenario, you can find certain keywords, right? So first of all, they're talking about the tooth. They're specific about the tooth, first right molar. So it's mandibular first molar, right side. And also lignocaine is used as a local anesthetic agent. It's inferior nerve block. So lignocaine is another keyword you have. And patient describes profound numbness, which means your anesthesia, you're successful in delivering local anesthesia, which is a good sign. But still, the moment dentist started with access opening, see, remember, they mentioned, or our team mentioned it as dentist, Dr. Hanisha. So should it be endodontist? We'll get back to that a bit later. So upon performing access opening, patient has pain. So another keyword. So 3 keywords based on which I'm sure you can answer this question. So mandibular first molar, it's a permanent tooth. Lignocaine, being used, which is the most one of the most commonly used LA agents, and also patient has pain in spite of experiencing numbness of ipsilateral or same side lip and tongue, etc. So, what do you think we should do? Since it's mentioned as dentist, should we consult an endodontist, or should we counsel the patient and motivate him so that this anxiety or maybe the pain subsides? Hypnosis, maybe we can try. Or should we wait for some time and then try again, or give another nerve block? Usually we do. If once block fails, we tend to give another block, right? Or is it intraligamentary injection? So I see most of you have answered the question. I don't know why you love intraligamentary. Have you ever tried intraligamentary? Some of you have chosen option B, wait for some time. Okay, if you wait for some time, don't you think the pain, the anesthesia which you have provided already subsides? Because we're talking about numbness of ipsilateral lip and tongue. And you have another patient waiting for you. So are you going to wait? So anyways, we'll move on to our virtual whiteboard. We'll discuss some points in regard to this. And then we'll move ahead. We'll get back to this question once again, okay? So first and foremost, let me ask you this question. What is hot tooth? So this is a case of a patient experiencing pain in spite of giving local anesthesia, which means the given tooth is still symptomatic. It's a clear-cut case of hot tooth, which we had experienced, and I'm sure most of you might have come across in your clinical setting or even your colleges, or those who are pursuing a master's in endo. I'm sure you might have come across these cases. So first of all, what is hot tooth? So according to information given in Grossman, we'll go by the literature given over there. So any tooth that is difficult to anesthetize is known as hot tooth. Anesthetize. Okay, that seems fair. So we're talking about hot tooth. And most commonly encountered hot tooth is very good, Sonali. Okay, we'll get back to those receptors, sodium receptors of C channels. So most commonly encountered tooth is the one which we're discussing in this case-based question, that is mandibular first molar. Not the only tooth, but most commonly encountered tooth. So as you can see in the case-based scenario, patient has numbness of lip and tongue. Anesthesia has been achieved, but not with that of tooth, right? So this is a classic finding. And patient experiences excruciating pain once the dentist or endodontist goes ahead with access opening. So what's the mechanism? So Sonali seems to be mentioning about TTTX. So what's that all about? So we have something called as tetrodotoxin resistant receptors, sensitive receptors and resistant receptors. These are sodium channels which are found or related to C fibers, C nerve fibers. So it's a mechanism of action. So there is a special class of sodium channels on C fibers known as tetrodotoxin resistant sodium channels, all caps except small r, okay? Tetrodotoxin resistant sodium channels. So these are considered to be a special class of channels which are receptors which are found in case of C fibers, right? So special class of sodium channels on C fibers known as tetrodotoxin resistant sodium channels. So why are we talking about these sodium channels? Because these tetrodotoxin resistant are found to be resistant to action of LA, in specific lignocaine or lidocaine, and also these are known to be 5 times more resistant, right, compared to any other type of LA or compared to any other receptors. So these channels are relatively resistant to lidocaine, and also these are 5 times more resistant to anesthetic than the other version of these same channels, which are known as tetrodotoxin sensitive sodium channels. So we're talking about resistant sodium channels. When compared to tetrodotoxin sensitive sodium channels, these channels are 5 times more resistant. So this expression of resistant channels or sensitive channels depends upon the inflammatory process or inflammatory reactions that are happening over there. So usually in case of inflammation, there is expression of more of these resistant channels, leading to obviously failed anesthesia, which is considered to be one of the mechanisms behind this hot tooth. Okay, so let me just put those words in the form of text so that you can make a note accordingly. So these are relatively resistant to lidocaine. And these resistant sodium channels are considered to be 5 times more resistant than their counterparts, in the sense tetrodotoxin sensitive sodium channels. Right? And there are still so many mechanisms which have been proposed. We will not go into depth. They are available in one of the articles, DCNA, one of the DCNA articles, Dental Clinics of North America. So it's an excellent review article on hot tooth. I mean, if you're interested, you can go through it. We'll post the link in the description part of the video. But in this live session, we'll restrict ourselves to the information given in Grossman 13th edition, which is a concise form of the previous editions, and it's more or less like a guide. I think this is to encourage students to study, right? And what about management? So this is something which actually is the thing which feeds dentists, right? So what's the management part? How do you manage? So as most of you have mentioned, we can go with supplemental injection techniques. So I'll just make a note of it. Supplemental injection techniques, like, as you said, intraligamentary periodontal injections, and you can also go with intraosseous injections. Okay, since we're talking about these resistant sodium channels being relatively resistant to lidocaine, bupivacaine, local anesthetic agent, is found to be very useful in such cases. So bupivacaine has been found to be more potent than lidocaine in blocking these tetrodotoxin resistant sodium channels. Okay, and it's considered to be the anesthetic of choice in case of hot tooth. Let me just extend it. Now it looks much better, right? So we'll take some stance and make it more aesthetic. So one of the secrets of maintaining an excellent notes is by making it aesthetic. Once any notes is aesthetic, you feel like actually going through it or even revising through it in your free time, or else we would never touch it, isn't it? So hot tooth, a tooth which is difficult to anesthetize. So we're seeing the mechanism behind this. We're talking about heterotoxin resistant sodium channels, which are components of C fibers, in specific C fibers, and the most commonly encountered tooth, as you can see, is mandibular first molar. So these tetrodotoxin resistant sodium channels are relatively resistant to lidocaine, and these are 5 times more resistant to tetrodotoxin sensitive sodium channels. And during inflammatory process, there is more expression of these tetrodotoxin resistant sodium channels compared to these sensitive sodium channels. And they're talking about supplemental injection techniques, intraligamentary, intraosseous, and also bupivacaine is considered to be anesthetic of choice when treating hot tooth, right? Now, I'm going to give you a homework question, but for that, I need to draw so that I can give you that question. So observe this carefully, okay? So you're going to find out and you're going to let me know tomorrow what this is all about. Okay, I'm trying my level best to draw this, and this is not Harry Potter's magic wand. I mean, if you want to call it that way, that's completely up to you. So even though I'm throwing some sparkles in and out here, so it's not Harry Potter's magic wand. It's a normal wand which we use in this particular context, especially in dealing with intraligamentary injections. Let me just take another color or highlighter. Yes. So what is this all about? What do you think I'm trying to do? No clue. So I'm talking about wand, which is used for intraligamentary injection. So what is this wand? Let me just write down the name itself for more clarity. Okay, so this is a wand which is used for, used during intraligamentary injection process. In fact, I've given you a hint. So find out what this wand is all about. Even though it doesn't appear this way, this is only for representation purpose, for sake of making our notes even more colorful. And when I say even more colorful, I think I should complete with this. In fact, our notes goes uncompleted or incomplete without this illustration. Yeah, so today the eyes are big. It means this guy is wide awake. So we'll drop in some ears, some hair. Now don't laugh at his hair, right? Because it's style. It's all about style these days. So we'll also put some paws, claw hand. Okay, normal palm. Right. So find out what this wand is all about, okay? So this is the thing which I wanted to highlight. Now, let's move on to our case-based patient before we conclude the session. So patient prepared for endodontic treatment of mandibular first molar, block with LA is given. The patient describes profound numbness, confirming Abosen's dentist goes ahead, but still there is pain, so we'll rule out other options as well. Counseling to reduce pain, even though pain is subjective, no matter how much we counsel, when there is an etiology over there, it's very difficult, no matter how many words we convey to the patient, isn't it? He is in pain or she is in pain. So counseling usually doesn't work, and I'm glad none of you have chosen that option, or did you? And wait for some time. Some of you said you could wait for some time, but unfortunately it doesn't work that way. Give another nerve block again with lignocaine, there's no point. I mean, if the option were give another nerve block using bupivacaine, maybe we can consider that, definitely. So we can rule it out as well. And intraligamentary injection, of course, yes. Supplemental injection techniques like intraligamentary and or intraosseous. And bupivacaine is considered to be the anesthetic of choice. I'm glad some of you are mentioning about wand. Try reviewing some additional information about this. Look at some review articles. Get back through mail. The reason why I'm asking you to get back through mail is, even though we've been getting several mails every day, the reason why I'm insisting on you again trying to drop a mail is so that you'll do it in an active fashion. If I say just try to find out, we might take it for granted. So try to find out, get back through mail. We are putting an additional tag to your mail as, I will not reveal that, but the best assignments will be published this weekend. We'll be including your name as well. Okay? So these are some of the topics which I wanted to highlight in this specific video. So intraligamentary injection, this is going to help you enormously in your clinical practice as well. I hope the session is informative. So your feedback is always welcome. Feel free to get back through mail 24/7. And as I said, I hope you had a wonderful day today. And we'll see you again tomorrow in our next 5 a.m. club. We'll discuss something positive. And after this session concludes, we'll post a question in Telegram updates group as well. So it's all about working hard, working consistently, and most importantly, believing in ourselves. And let me conclude with this. We all have reasons, and we all try finding out reasons, either consciously or maybe even without our knowledge, we try seeking reasons to not act. It can happen to every one of us. But remember, it doesn't matter what these reasons are. Ultimately, to each and every one of us, what matters is action over inaction, as I mentioned in one of the previous posts. So no matter what the reasons are, we all have a choice to overcome the given challenges and to go ahead only for our sake, isn't it? So let's keep the reasons aside and let's start working towards results. Customized results, not just talking about the first rank. Customized results, results which you want to see. So wish you all the best. Love you all. Have a great night's sleep and try to sleep early so that you can wake up early. Many of you are missing 5 a.m. sessions. I know it's a challenge to wake up early in the morning, but only successful people start their day very early. Mark my words, it's only successful people. So if you want to be successful, wake up early, start your day early, experience difference. Bye.